Assalamu alaikum. Today we are going to read AKP clinical case number 13, that is a 6-month-old boy with fits. This is a case of previously well 6-month-old boy who presented with prolonged seizures lasting over an hour despite receiving buccal midazolam in the ambulance and intravenous lorazepam in the hospital. The seizures recurred after being transferred to the ward. Upon admission, his vitals were stable, temperature 37 degrees centigrade, heart rate 140 per minute, shows normal for age, respiratory rate 30 per minute, normal for age, capillary refill time is 2 seconds, normal, oxygen saturation 95% normal, blood pressure 80 by 50 mm of mercury, normal for age. The absence of fever, infections, or focal neurological signs, along with the stable vital signs, suggest a metabolic cause for the seizures. His blood test revealed several important findings that pointed to a metabolic cause for the seizures. It shows calcium 1.2 millimole per liter, that is low calcium. Hypocalcemia is identified, which is a key trigger for seizures in infants. Low calcium makes the neurons more excitable, increasing the likelihood of seizures. Phosphate 1.2, that is low. This indicates a problem with bone mineralization or vitamin D metabolism, both characteristics of rickets. Elevated alkaline phosphatase suggests increased bone turnover, commonly seen in rickets where there is a deficiency in bone mineralization. Liver function was normal. These values exclude liver disease, which could interfere with vitamin D metabolism. Normal renal function. These normal values exclude renal failure as the cause of hypocalcemia, and also normal inflammatory markers. These results rule out infection or inflammatory condition as the cause of the seizure. Let's solve the first question. Which of the following is the most likely diagnosis? Select one answer only. Options are hypoparathyroidism, intestinal malabsorption, liver disease, nutritional rickets, and renal failure. The most likely diagnosis is nutritional rickets caused by vitamin D deficiency. Vitamin D is essential for calcium absorption in the intestines. Its deficiency leads to hypocalcemia, which then triggers seizures in infants. So the blood results shows low calcium, low phosphate, and elevated ALP strongly supports this diagnosis. The absence of any systemic issues like liver or renal problems further confirms nutritional rickets as the cause. Rule out other options, unlikely as this typically present with low parathyroid hormone, and this child has secondary hyperparathyroidism. Next, intestinal malabsorption. This is unlikely as the child has normal albumin levels and no gastrointestinal symptoms. Malabsorption often result in low albumin due to protein loss. Next, liver disease. It excluded as liver function tests are normal. Liver disease would affect vitamin D metabolism, leading to elevated liver enzymes. Next, renal failure. It is also excluded as renal function is normal, ruling out kidney dysfunction as the cause of hypocalcemia. Let's come to the second question. What would be your first line of management? Select one answer only. So after getting investigations and confirming the diagnosis, the first line treatment is IV calcium gluconate. It administered slowly via a secure intravenous line to avoid tissue damage. It helps normalize serum calcium levels, stopping the seizures. If seizures persist despite calcium correction, anticonvulsant, for example lorazepam or phenytoin, can be used as temporary measures. Rule out other options. Buccal midazolam, this was already administered in the ambulance without effect. It does not address the hypocalcemia that caused the seizures. Next, IV lorazepam, while initially used to control seizures, it does not address the underlying cause of hypocalcemia. It is temporary measure. IV phenytoin, it is used for prolonged seizures not responding to benzodiazepines, but does not address here. Next, rectal diazepam. Like midazolam and lorazepam, diazepam helps control seizures, but it does not treat the cause. Correct answer is IV calcium gluconate. This case shows the importance of recognizing nutritional rickets as a potential cause of seizures due to hypocalcemia in infants. The definitive treatment is IV calcium gluconate to correct the hypocalcemia, followed by vitamin D supplementation and dietary management to prevent recurrence. Early diagnosis and proper management can prevent long-term complications and ensure proper growth and development for the child. Thank you so much for watching. If you have any question regarding this case, comment below, like, subscribe, and share.